I'm very happy with it because that's the only way I can get to a doctor is through my GAP.
The Quebec government and the province's Family Doctors Federation, the FMOQ, reached a deal to continue providing access to patients without a family doctor through a government service known as the GAP.
We're very happy that there is an extension with this agreement, with this entente. However, this entente, and let's be clear, addresses an immediate need and does not deal with the underlying problems.
I've been on a 3-year waiting list just to get a provider to help me with the smallest things, colds and things such as that. So with GAP, it's working, and I hope it continues.
The GAP program has served about 900,000 patients in Quebec, but the agreement expired on June 1st, meaning family doctors had no obligation to continue seeing these patients. When the program launched in 2022, doctors received a $120 per year bonus for each new patient registered at their clinic. The new deal reduces the bonus to $100.
It is paid a bit differently this time. Doctors will be penalized for no-shows, which is really out of our control, so that's not ideal. And there is some flexibility in when these appointments can be given, which makes sense. So in other words, fewer GAP appointments will be devoted to the summer and more towards the winter and the busy flu season.
It's an incentive for doctors to work more, for GPs to work more. And I think that's interesting for the general population too, because a GP by definition is someone who addresses the majority of the personal health care needs for the general population.
The Doctors Federation says that its members voluntarily participate in the GAP program, so it's possible that some family doctors may not continue to be involved in it. However, it appears that the dispute has had an impact on patients as the number of appointments through the GAP program dropped from 17,604 during the week of May 18th to 1,133 for the week of June 9th.
We do pay for Medicare, so they should be able to take care of the people, of the 900,000 people that do need it.
What can I tell you? The healthcare system in this province sucks, plain and simple.
We have to work towards a solution. The GAP is an interim measure. We have to remember that. It's about providing access to people who do not have a doctor. But the government has to get their act together and find doctors. This is not going to get solved. It's going to get worse as our doctors age and retire. And this is going to get worse and worse over the next few years.
In Montreal, Gareth Madoc-Jones, City News.